Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about eye bags. What are the risks, what are the complications, and what are the potential side effects? So in answering this question, well, there's a few things that we need to consider. And first of all, we need to consider, well, what exactly are eye bags? And in that, what exactly does not include eye bags? And what are the key benefits of removing eye bags? What does the procedure involve? And this is of key importance to what are the potential complications and side effects. Then I'm going to show you a few different examples and cases of patients of mine who've had eye bags and had them removed. Then we're going to talk about the risks and the complications based around this. And then finally, my personal tips if you're considering having eye bag treatment or eye bag surgery. So first of all, a little bit about myself. My name's Dr. De Silva. I'm a facial, cosmetic and oculoplastic surgeon in London. And my 3 procedures that I perform every day for patients are eyelid surgery, blepharoplasty, rhinoplasty and face and neck lift surgery. And I have been in practice for over 10 years. I have worked in the cosmetic centers of Los Angeles and New York and set up my practice in London. And I've won various awards and published over 3 books in this field. A small medical disclaimer, any of this information has to be taken in context. It's only for education and informational purposes, and it cannot constitute a consultation. You really need to see a doctor to do that. So first of all, what are eye bags? Well, eye bags are puffy lower eyelids, and this puffiness is related to fat creeping forwards in the eyelid. Now this puffiness actually completely compares and contrasts to the underlying natural anatomy of the eyelid. And it's fat that your eye sits on, and some of that fat is coming forwards in the eyelid and it creates a bulge or fullness. Now there are various factors that can affect this, and this can be aging, there can be genetic factors, you can see other family members that have similar changes, and there are of course environmental factors, things like smoking. Well, this really doesn't help with the formulation or development of eye bags. What are not eye bags? And this is particularly important because if you have some of these kind of characteristics in your eyes, well, it's important to remember this does not represent fat, and so it can be more challenging to treat. Festoons are a good example of this, and festoons are a puffiness of the cheek. And so in this patient you can see, well, here we have a classical eye bag where there's fat coming forwards, but if you look lower down you can see there's this puffiness here, almost like a triangle. And this is actually the cheek, and in medicine the cheek is called a malar, and the malar here is swollen, and this is sometimes called malar bags or festoons, and this requires a different kind of treatment, and it's a more challenging treatment than eye bags. Now there's also other characteristics that you can see in the eyes, and this patient has lower eyelid retraction. The lower eyelid sits much lower than the colored part of the eye, the iris. And so this needs a different form of procedure, not just blepharoplasty, to improve this. Now there are actually many other characteristics of the eyes that do not fit with eye bags, and just some of these include ptosis, love band, skin. All of these things require slightly modified treatment, because if you want the best results from eyelid procedure, these often have to be looked at the same time. So what are the key benefits of lower eyelid surgery? Well, the common things that patients talk about are, well, friends say to me, I'm looking tired. Friends ask me, am I going without sleep? Have I been stressed? Now, many of these factors are completely unrelated to puffiness in the lower eyelid and lower eyelid bags. However, this is what people associate with being tired. Well, reducing this puffiness, improving the shape and contour of the lower eyelid, well, often it just makes you look refreshed and with natural surgery, most people will not notice. The best compliments you can receive is someone says, well, you look refreshed, you look better, what's happened? Of course, many of the patients who come to me have tried other things such as creams and ointments, and unfortunately the puffiness that we're talking about is related to the underlying anatomy, the fat, and really creams and ointments, and although they marketed very well, often people are very disappointed because they make actually very little difference to eyelid bags. So what is the procedure involved? Well, this is of key importance when we're thinking about, what are the risks, what are the potential side effects? Well, there's really two main ways that lower eyelid surgery and bag treatment can be completed. And lower eyelids, well, the term used for surgery in this area is called Blepharoplasty, after a Greek word. And Blepharoplasty in the lower eyelid can be completed on the outside of the eyelid, and this is through the skin. And this is, in medical jargon, it's called transcutaneous. And this is the older way that the surgery was completed for many, many decades. And then there's a newer, more modern way where the surgery is completed on the inside of the eyelid. So the eyelid is pulled down and a hidden incision on the inside of the eyelid is made. And this is called transcutaneous. And this is a more modern way of doing the surgery. And this is very important because this really does reduce the risks and complications from lower eyelid surgery. And I'm a really strong advocate of this form of surgery, as it preserves the natural anatomy and it preserves the natural shape of your eye, and it reduces risks and complications. So let's have a look at a few different cases of eye bags and just talk about what are the aspects of this. And so the classic eye bags are these really quite prominent puffiness in the lower eye, and often it comes about over many years, and this puffiness can have other characteristics as well, but primarily blepharoplasty means taking away some of the puffy fat and repositioning some of the puffy fat. And by doing that, well, you can have a really smooth contour to the lower eyelid, and really a person can look many years refreshed in the process. Hollowness under the eyelids. Well, this is often a characteristic seen by a circle or ring under the eyelid. It often has a darker appearance, it catches the light, and it often constitutes what people describe as, well, you look tired, a more tired appearance. So this, in my opinion, really needs to be addressed at the time of lower eyelid surgery and lower blepharoplasty, and it really needs volume. Now, if it's very mild and very early, sometimes a filler can be used, but in the context of surgery and blepharoplasty, my preference is to complete fat transfer, which means taking a small amount of fat from just around the belly button, and there's no scars there, concentrating that fat and putting a small amount just into this kind of depression under the eye. And by doing that, well, you can just make this area so much smoother and more even. And fat transfer around the lower eyelids, and certainly in my hands, lasts for many years. I've seen patients more than 5 years after surgery and their fat transfer survives very well. Skin. Well, skin is very important in this area because many patients have very fine, thin skin, and when you smile, you get a few more lines, and this really needs to be looked after at the same time. And for patients who have just mild loose skin, well, I use a state-of-the-art laser, a CO2 laser that will polish and tighten the skin. But if you have a lot of loose skin, like in this case here, where there's a lot of lines and wrinkles, even without the patient smiling, well, often a skin pinch is required, where a small amount of skin is just removed with a tiny scar just beneath the eyelashes, just to take away that skin. Young patients. Well, I have many patients come to see me who are young, and these patients, well, there's always a genetic element to this. Sometimes you can see other family members who've got similar changes. Sometimes you can just be unlucky. But often the characteristics are very good quality skin, but this kind of shadowing and a depression and some mild puffiness. Now, some of these patients can be treated non-surgically with filler. Some patients prefer not to have filler, and unfortunately filler in this area can be really quite challenging, and some weeks I dissolve many patients' filler because it can cause puffiness and other issues around the lower eyelid. Now, for these patients, in my opinion, well, you really need to offer fat transfer to give these patients the very best long-term result, because often we're looking at decades into the future, and to give these patients the best result going forward, you need to look at what's going to give the best long-term results. Revision surgery. Well, revision blepharoplasty can be extremely challenging, and the reason is, well, the anatomy around the eyelids is extremely delicate. Everything is fractions of millimeters, and often there is scarring, often there is change in the underlying natural anatomy, and so all of these need to be considered. And any surgery that is revision, second revision or third revision surgery must be done very delicately to give like a good result. And then ethnic patients. And in ethnic patients, well, there are some changes or differences in the natural anatomy that need to be considered when completing the surgery. And this relates to the underlying bone and the orbit and the shape of the orbit. So for example, this patient, well, she had the appearance of lower eyelid retraction where the lower eyelid was sitting below the level of the colored iris. However, it's important to lift that lower eyelid with a slightly modified procedure called a canthoplasty in order to give the best possible result. So now we come on to risks and complications. And in a way, we've touched on some of the important elements of this so far. And the common things are swelling, bruising, and expectations from surgery. And some patients will have a bit more swelling, and it takes a little longer for the swelling to go down. And sometimes there could be medical factors, like if you have immune medical conditions or thyroid eye disease, well, these factors need to be taken into account, and your doctor can give you different medications and modify the surgery to enhance your healing. In terms of bruising, well, most of my patients don't have bruising, but in terms of reducing bruising, formulations of herbal medicines can be used to enhance recovery after bruising. And in terms of expectations, well, in this area of the lower eyelid, the skin is less than 1 millimeter thick. And so consideration needs to be given to the fact that it can be improved, but it's so hard to make perfect. And so there needs to be reasonable expectations for like improvement. And then moving on from that, things like infection, extremely rare in eyelid surgery, things like discomfort and pain, these are not common features of healing and recovery. However, sometimes there can be a level of discomfort or tightness, and although most patients don't feel that much, more than 50% of my patients don't use analgesia after lower eyelid surgery. Sometimes you can be a bit more sensitive and analgesia is required. The two most serious issues with lower eyelid retraction, well, one would be eyelid retraction and the other would be blindness. And I haven't had patients have either of these, but it's very important to look at the reasoning why these things happen and take precautions before surgery in order to avoid these. Now, eyelid retraction is an unfortunate condition where the eyelid pulls down after surgery because of a scar in the eyelid. Now, this can be largely prevented with technique. Doing the surgery in the older way, transcutaneous, where the surgeon goes through all the layers of the skin to get to the puffy fat, that can create a scar that pulls the eyelid down. A more modern way of doing the surgery on the inside of the eyelid that I described to you as transconjunctival, well, that avoids like a scar in the middle of the eyelid and it preserves the natural anatomy, and so lower eyelid retraction doesn't happen. But the older way of doing the surgery is still the main way it's completed, and so in my opinion, for this kind of surgery, it's important to do the surgery on the inside of the eyelid by a transconjunctival technique. Blindness, well, this is a very serious and largely avoidable issue with eyelid surgery. It's very important that various precautions are taken before surgery. Just to give you one, well, it's important to check blood pressure before surgery, because if your blood pressure is raised or high, well, that can carry a risk of bleeding behind the eye. And if there's bleeding behind the eye, that has the potential to affect vision and damage vision. And so taking those kind of precautions before surgery, those risks can be reduced and largely eliminated. And at least 3 times a year when I treat my patients, I will find like a patient who has high blood pressure at the preoperative appointment, and those patients I am cautious to control their blood pressure before doing eyelid surgery. So in terms of like risks and complications, well, the important thing to remember with the lower eyelid is the anatomy is very important. It is extremely delicate, and everything is millimeters or fractions of millimeters. And so any surgery done in this area needs to be done considerately and precisionally. So my tips for lower eyelid blepharoplasty and avoiding complications, avoiding side effects, and having the best possible result. Well, in terms of your surgeon, you really need an expert, someone who does eyelid surgery every day. And there are different specialties that offer this kind of surgery. There's oculoplastic surgeons, facial plastic surgeons trained in ENT, plastic surgeons. All of these surgeons specialize in different areas, and you really want to find a surgeon who's performing aesthetic or cosmetic eyelid surgery on a daily basis, because it's really with that expertise of really looking at this finer detail, you're going to get the best result for you. Cost versus quality. Well, of course, cost can be important, but if you're really looking for the lowest cost, often that's not going to give you the best result, because this is really a surgery of detail, and it's all the fine detail that goes around eyelid surgery that is going to give the best result. Now, eyelid surgery could be completed in half an hour, but really to look at the detail of the skin, to look at the detail of fat and fat transfer, other factors such as laser, it really is going to take an hour and a half, and for some patients it's going to take longer than that to give the best result. The detail is very important, and this is important to look at some of the criteria that are not covered by lower eyelid and blepharoplasty, and some of those I mentioned to you, like festoons. Well, these require a slightly modified treatment, and it's important that these are treated at the same time to give the very best results. New technology, well, there's always new technology and new promise, and one technology that has appeared over the last few years, Plexer, well, this uses a method of tightening the skin, and unfortunately many of the patients who come to see me who've had that treatment have been disappointed by the treatment. And so I think although it may offer advantage for some patients, new technology is not always an improvement. Another new technology is tissue glue, and I personally used this for many patients like years ago, but I now believe that that doesn't really give any more favorable results than other more enhanced techniques. Patient experience. Well, one aspect is looking at the results from surgery, but patient experience is really important, and it's both like a physical recovery, like in terms of swelling and bruising, but it's also an emotional journey, and it's important that you trust your doctor in order to give you the best possible experience as well as the best possible result. And one way of looking at this could be looking at reviews of doctors, reviews of your surgeon, to see that it fits with what you're looking for. Operating facility, well, I personally have like an operating facility that's specialized for facial, cosmetic and plastic surgery, and so it's customized for those patients. And often, like if you go to a general hospital that might be treating patients with all kinds of reconstructive surgery, well, your experience may not be quite of the same experience. Life events. All of us have, in terms of life, a roller coaster. There's certain points in the life where you're up and about and you're having the best time in the world, and there could be certain parts of your life where you feel a bit low or there's a negative life event. And when considering the timing to having eyelid surgery or eyelid bags, it's important that you have a relative plateau. You don't want to do this after a serious breakup or a serious life event. You want to give some time so that the emotion of that event can be settled, and then you can have like a smooth journey and a smooth recovery and enjoy the results. And finally, well, you need to do your research. And There's no shortcut. You need to look into some of the detail behind this, and you need to see maybe a specialist who completes this kind of surgery and ask questions that you feel are relevant to you. So, in summary, well, eye bags. We've talked about the risks, the complications, side effects. We've talked about what are eye bags, what are not eye bags. We've talked about the key benefits of the procedure. We've talked about what are the different types of procedure and how important those are for avoiding complications. We've talked about different types of cases and the results you can expect from them. We've talked about the common aspects of healing and recovery, and we've talked about the more serious risks and complications. And finally, I've given you my tips on eye bags and how to get the best results. I do hope this information has been useful for you, and if you have any further questions or any points that you would like me to address, please do not hesitate to contact me. Either you can go to my website or message me directly.